Casey and Arde, and for today I am going to perform a parenteral drug administration return demonstration using the intradermal, subcutaneous, and intramuscular injections. The procedure that I'm going to perform is the intradermal injections. Prior to the conduct of the procedure, first, we need to check the physician's order on the patient's medical record. This is done to identify the kind of drug to be given to the assigned patient. To identify the drug name, its dosage, the route of administration, and the time it is to be given. After that, we are going to perform hand hygiene. To prepare the medication, of course, we need to have a syringe, aspirating needle, a sterile water to serve as our medication, a cotton balls, and a alcohol. To prepare the medication for intradermal injection, first we have to get the syringe, open the package, always remember that we only hold the barrel and the plunger only. We need to remove the needle and change it with the aspirating needle. Then we are going to get the sterile water or the medication, clean the top or the rubber seal of the medication using the cotton ball soaked in 70% alcohol. And now get the syringe, uncap the syringe, and we are going to draw an air inside the syringe. Make sure that the connection of the aspirating needle and the injection is not loose. The equal of the air that we withdraw inside the syringe is the equal of the medications that the physician's order to the patient. Then we are going to inject the air into the vial. Then invert the vial and draw a medication that is exactly needed. If there is an air or bubble, the needle gently tap the syringe. And now we are going to remove the aspirating needle. And put the original syringe of the injection. Make sure that is not loose. And now discard the aspirating needle into the waste receptacles. Do not forget to take note of the name of the drug, the dosage, so that we cannot forget it. First, check the medication order on the patient's chart. Then, introduce yourself to the patient, verify the patient, and explain the procedure to the patient. Good day, ma'am. So, I am Casey Ann Arde. I am your midwife for today. May I know your name?
Arde.
And your age?
13.
So, ma'am, your doctor ordered a penicillin skin test. So, I am going to inject a small amount of penicillin in your skin to check if you are allergic to any penicillin medication. Is that okay with you? Then next, we are going to perform hand hygiene. Now select an injection site that free of lesions or skin discolorations. Position the client's arm so that the forearm and the elbow are in a flat surface. And then we are going to apply clean gloves. Now, use a antiseptic swab or cotton balls to clean the site, beginning at the center in a circular motion into outward. Then we are going to remove the cap and hold the syringe using the forefinger and thumb, and the bevel of the needle is pointing up. Stretch the skin using the non-dominant hand by gently pulling the skin. Pull the needle close to the patient's skin and insert the needle about 5 to 15 degree angle. And insert the medication gently. Until you see a bleb resemblance of a mosquito bite's appearance. If the will appear, withdraw the needle in the same angle to avoid a tissue damage. Then pat dry cotton balls. Do not massage the area. Now encircle the wheel with a black or a blue pen. And instruct the patient that do not rub the area or erase the mark. Okay, ma'am, we are done with your skin test, and we have to wait a few minutes to wait for the result. Okay? Please do not massage the area or erase the mark. Okay? Thank you for your cooperation, ma'am. Now I'm going to remove my gloves and dispose it in a proper area. And dispose all the used needles in a waste receptacles. Then we are going to perform hand hygiene and then document the procedure and interpret the result. And the next procedure is a subcutaneous injections. Prior to the conduct of the procedure, first you have to check the doctor's order and then compare the medication. So it is the same. Then we are going to perform hand hygiene. Then we are going to prepare all the equipments needed for the subcutaneous injection. To prepare a medication for subcutaneous injection, we have to have a insulin syringe. Open the sterile pack and hold only the barrel and the plunger of the syringe. Do not touch the needle to avoid contaminations of the needle. We are going to uncap the syringe and draw an air into the syringe with the exact amount of the medication needed, and then insert the air into the vial. Then invert the vial and withdraw a medication that is needed. If there is a bubble on the syringe, gently tap the needle. And then now we are going to recap the syringe or the needle and put the syringe or the medication in the hypodermic tray. And then write the drug name and the dosage in the patient's medication ticket. Then we are going to check the medications order into the medication chart of the patient. Then you are going to introduce ourselves to the patients, identify the patients, and explain the procedure to the patient. So good day, ma'am. I am Casey Ann Arde. May I know your name?
Arde.
And your age, please?
13.
Okay, thank you. So, ma'am, for today we are going to do a subcutaneous injection. I am going to inject an insulin in this part of your body. And insulin is to control your blood sugar since you have a type 1 diabetes. Is that okay with you? Then next, we are going to perform hand hygiene. Then determine which side will be used. And then we are going to arrange the medication card into the hypodermic tray with the corresponding drugs. Then we are going to determine which side or rods will be used and expose the sides chosen. Let's assume that this is our site. Then we are going to inspect the area of any bruising or any inflammations. Then we are going to palpate the site and avoid the area with any tenderness. Then, after palpating the site, place the patient in a comfortable position. Then, and tell the patient that he or she will relax her or his abdomen. Then, we are going to apply clean gloves. Then we are going to use a antiseptic swabs to clean the site. Starting from the center, circular going upward. Then we are going to uncap the syringe and hold the needle using your thumb and your forefinger and holding it as if you are holding a dart. Then we are going to insert the needle quickly and firmly at the 45-degree angle. Then we are going to inject the medication of several seconds. Then we are going to quickly withdraw the needle and place the swab on the side and don't massage the area. Then place the patient in a comfortable position and document all the procedure, and they are going to remove our gloves and perform hand hygiene. And the next procedure is the intramuscular injection. First, check the doctor's order and get the exact medication needed through calculation. Then you are going to perform hand hygiene. Then, let's withdraw the medication from this ampule or vial. First, we need to have a needle. Make sure that you only touch the plunger of the needle and the barrel. Then, change the connected needle to the syringe into a aspirating needle. Make sure that it will not loose. Then we are going to open and clean the surface, the rubber surface of the medication vial. Then we are going to get the syringe and uncap the syringe, and we are going to draw an air with the exact medication that we are need. Let's assume that will be needing a 1 ml of a medication. And now we are going to inject the air into the vial. Then invert the vial. Let's make sure that we are only getting the exact amount of medication. If it has air, gently tap the syringe. The next we are going to do is to remove this aspirating needle. and put it in a proper waste disposal and put back the original needle. Make sure that the needle and the syringe is connected properly and it is not loose. After putting the medication in the hypodermic tray, write the drug name and the dosage of the drug in the medication ticket of the patient. Then place the medication ticket on the hypodermic tray. Then next, we are going to check the doctor's order on the patient's chart and compare it with the medication. So it is the same. Then we are going to introduce ourselves to the patient, identify the patient, and of course explain the procedure to the patient. Then we are going to select a appropriate site for the injection. Vastus literalis and deltoid muscles are the best way to inject a intramuscular injection. Then you are going to examine the integrity and the amount of the patient's muscle mass, and we are going to palpate the site. If there is a tenderness, the site will not be suitable for any injection. Let's assume that this is our site, which is the deltoid muscle here. Then we are going to inspect the site of any inflammations or any swellings. Then we are going to perform hand hygiene and apply gloves. Then now we are going to clean the area using a antiseptic cotton balls from the center in a circular motion outward. Then we are going to uncap the syringe and hold the syringe using a thumb and a forefinger as if you are holding a dart. Then you are going to insert the syringe in a 90-degree angle. Then you are going to aspirate it by pulling the plunger. If bloods appear, it means you are hit a blood vessel. Remove and discard the needles, and you are going to start over. Then you are going to insert the medication. Then slowly remove the syringe. Then we are going to release the skin and place a gauze or a swab. Apply a gentle pressure on it, but do not massage the area. Then place the patient in a comfortable position. Then document the procedure that you have done and remove our gloves. Then perform hand hygiene. Just tell to the patient that he or she must avoid to massage the injection site or the area. Then thank your patient for his or her good cooperation.
I know is not enough.